Hello everyone, I'm Dr. Julian Escobar at Conceive Fertility Center. Today we'd like to talk about unexplained infertility, it's the best and it's the worst diagnosis you could have. It's the best diagnosis because it just means that you're perfect, you look perfect, your partner appears perfect, but yet you're not conceiving. And so that can bring a lot of frustrations because you've had sleepless nights, you've been on Google, and you really want to find the reason why so that you can find a solution to your problem. So unexplained infertility brings on its own more frustrations to patients a lot of the time. But you're not alone. It's 15% of couples. So of course, it's going to depend on the population. But that basically means that you're ovulating. So that means that you're having monthly menses. That means that your HSG or hysterosalpingogram was done and your fallopian tubes are patent or opened and digest was able to flow fine. And it also means that your partner has a normal semen analysis. So if you have those, if you're ovulatory, you have patent tubes, and you have normal sperm, you're considered to have unexplained infertility. To be honest, to finalize the complete diagnosis, you also would do a sonohysterogram or some type of uterine testing, but usually those tend to be minor things. So if you've undergone all the testing and everything is normal, then what do you do? Well, you don't necessarily just go back to doing what you were doing because that wasn't working. So you need to basically become a better you, and so your partner. And so for women, we make you ovulate better. Normally, you ovulate one egg a month, and so in this case, we want you to be superwoman and produce 2 or 3 eggs per month, depending on your age. And we do that with ovulation induction medications, mostly pills that you take for 5 days during your month, and that's enough to stimulate you. Sometimes we have to add a touch of injections. And for your partner, we still want you guys to have sex, but the day you're most fertile, we're gonna put tons of his sperm in your uterus. So for example, when you guys have intercourse, about 2,000 sperm make it to your uterus out of millions. When we do an insemination or an IUI, intrauterine insemination, we put about 5 to 20 million sperm inside your uterus. So you're comparing 1 egg versus 2 to 3, and then you're comparing 2,000 sperm versus millions, plus the timing. And so we hope that by making you guys superhuman, we can get you guys pregnant. If that doesn't work, we still have IVF in our armamentarium, surgery sometimes, and other things that can be done, but the usual starting point is ovulation induction and IUI. Take care.